So I am welcoming all of us into this health session. And today we are blessed to have Dr. Munyiri coming all the way from AAR Hospital. And he has a good message to us this afternoon. And I want to believe that you, just as myself, is ready to receive the word, right? So thanks so much, Dr. Munyiri. Kindly come forward and talk to us kindly, please.
Good afternoon, church. Praise God. Praise God again. Yes, as introduced, my name is Dr. Munyiri. I am a general practitioner from AAR, section 58. How many of you know that branch of AAR? How many? By a show of hands? Yes, so we have a branch at just opposite State House on the road to Free Area. So you're welcome. So this afternoon I want to briefly speak about, who knows the topic for today, what we are speaking about? Or who has an idea? Helen? Okay, so we'll be discussing briefly about viruses. We've all had viruses, the term viruses, so I want to just take you through briefly. I hope I will be able to speak to what we call, I hope I will not be too technical, because the issue is when it comes to explaining the medical stuff, sometimes we might be too technical, but I hope I'll just keep it simple. So let's start. What are viruses? So viruses are they are non-living things which usually cause illnesses or infections in humans, yeah? So we have what we call bacteria, we have viruses, we have protozoa. So all those, we have what we call fungi. All those things usually cause infections in humans. So today we will focus on viruses. And so as we've all had, the most recent outbreak was coronavirus, okay? So coronavirus is a type of a virus which usually causes infection in the respiratory system. So viruses, as I've said, they are non-living. They are not alive. So you cannot kill a virus, okay? Because in the first place, it is not alive, okay? So what you usually do is to inactivate it, and that is why viruses have a tendency to cause what we call recurring infections, okay? So sometimes you've seen a person with the flu. You see, when we get the flu, that gives you some sores in your mouth, okay? So that is a virus called herpes simplex, yeah? Type 1. So it causes, you get it as a child when you're exposed to bodily fluid, okay? Mostly from your parents. And what happens is that this virus usually stays in your nerves as dormant, so it has a tendency to be activated from time to time, maybe when your immune system is low, okay? So viruses have what we call a chronic or life cycle, okay? So they stay in your body, not necessarily causing disease. They are dormant, so when they are activated, that's when they cause disease. So viruses cannot survive on their own, okay? So they need to infect, okay? They need to infect a person so that they can multiply or what we call replicate, okay? So virusi outside they do not, they cannot replicate on their own. So they need to infect you, ndio ziweze kuzaana. Okay? So simply speaking, so viruses are made of either DNA or RNA. We've all heard of the term DNA, okay? So they usually have DNA and RNA surrounded by what we call a protein coat, okay? And that is very important when you know about this, cause it guides us on what we need to do to deal with viruses. So we've said you cannot kill a virus, so how do you inactivate it? So one of the issues, how you can deal with it is usually through hand washing. Just a basic hand washing with soap and water, okay? So when you use soap, it usually kills the protein that usually covers the DNA material of the virus. And that is why we usually say, so tunakumbuka wakati wa COVID tulikuwa tunaambiwa utembe, there was hand washing areas everywhere, and the alcohol hand sanitizers, okay? So basically how it was working, it was destroying that protein that usually covers the DNA. So when the DNA is exposed, it cannot survive, okay? So what are some of the common infections caused by viruses? So I'll just group them into how or where they infect, yeah? So we have respiratory viruses. So hizi zinaleta ugonjwa kwenye mapafu, okay? Or what we call the respiratory system, which includes your nose, your throat, your lungs, okay? So hapo kwa hizo viruses, tuko na viruses inaitwa influenza, okay? Wangapi wamesikia about influenza? Okay? So influenza is the most common cause of homa, okay? Hii homa tu ya kawaida tu, the sneezing, the running nose, okay? So it's caused by influenza. And influenza, another thing with viruses is that they usually mutate haraka sana. So they usually change. They adapt to how the environment is, okay? And that is why we will come for immunization or vaccination against influenza, and we will tell you that that vaccine only covers you for 1 year, okay? Because the viruses, they keep on adapting and they are trying also to survive, okay? So another one is, so the common cold caused by what we call rhinoviruses. Coronavirus is also a type of respiratory virus, okay? So we all know about COVID, so, and you remember even in COVID we had different strains, tulikuwa tunasema Delta, si ndio? So there were different, because it keeps on changing, and that makes it very difficult to even treat, okay? Because unapata sasa, you might prepare a vaccine for a certain strain, and then in a few months, it has already changed, okay? So another one is another group is that causing childhood infection. This is very important. So children are one of the, because of the weak immunity, they are very susceptible ama wanapata hizi infections za virusi haraka. So the good thing is that most of the illnesses usually have vaccines, okay? So utapata watoto wanadungwa chanjo in the various times as they grow. So kuna viruses kama chickenpox. So hiyo chickenpox, mumps, all those are caused by viruses, okay? We have measles, So we also have rotavirus. How many know about rotavirus? Nani wangapi wamesikia rota? Yes, so it's the most common cause of diarrhea in children. Okay, so unapata watoto wengi cause of that age wakati wana they are crawling, so wanaokota uchafu, so they ingest, okay, wanakula hiyo uchafu, they get rotavirus. And the treatment is usually for rotavirus is different from, let's say, a bacterial infection. That is why it's very important to come to hospital. If a child has diarrhea, bring the child to hospital so that we run test, find out whether it's a bacterial or it's a viral infection, because if it's a viral infection, that child does not need to be exposed to antibiotics, okay? Because viruses don't respond to antibiotics. So another important virus is a virus called human papillomavirus, or HPV, okay? I know the ladies have heard about HPV. So there are so many subtypes of HPV, okay? Actually almost hundreds, eh? So we have, so basically HPV causes skin infections, or what we call warts, okay? So we have, under HPV we have what we call low risk and high risk viruses. Of importance, and why are we talking about HPV? It's because of its relation to cervical cancer, okay, in our women. And cervical cancer is the leading cause of mortality or death in women, okay? And why is HPV important? It's because if diagnosed early, it can be prevented. So it can be prevented or treated, okay? In relation to its cause or its role in causing cervical cancer. So HPV, the high risk subtypes are what are usually associated with cervical cancer, okay? So, and let me just speak a bit about HPV and cervical cancer. So what we have seen is that HPV infection, which usually happens early, exposure usually happens from, let's say, around 20 years, okay? And this cervical cancer usually develops years later, okay? So that is why we are saying that we've all heard of the HPV vaccine, which is being given to our girls, okay? From the age of 9 to 14, okay? How you get HPV is usually transmitted through sexual intercourse, okay? So that is why we are saying these girls, 9 to 14, they get the vaccine and they are able to, it prevents them from being infected with HPV, which has been shown to cause cervical cancer. So what happens is that, as we said, the virus has to infect your cells so that it can replicate. So what happens is it infects your cervical cells and it causes changes there in the DNA of your cells so that they now become cancerous. And cancer basically is multiplication of your cells without the normal regulation by the body. So this has been shown to be a process taking over 10 to 20 years, okay? So, and that is why we advocate for what we call a pap smear, okay? Any woman of reproductive age that is between 21 years and 65 years should be getting a pap smear, at least, we usually say 3 yearly, okay? But it depends on what will be seen on the first pap smear. That is what will guide us on how we are going to be reviewing your pap smear. But for a normal pap smear, it's usually done every 2 to 3 years, okay? So I would want to encourage everyone here between the age of 21 and 65, Okay, if you are going to pick something from this talk, is to go and have a pap smear done. Okay, it has been shown to prevent and treat changes that lead to cervical cancer early. Okay, yeah. So the other one is we have systemic viruses. We all know about HIV. So it's called human immunodeficiency virus. So this one attacks your immune system. So your immune system ndio inapigana na magonjwa kwa mwili. So you can imagine a virus that now comes and kills your defense. Okay? So and what usually say what kills the patient infected by HIV is usually not even HIV itself, okay? It's other illnesses because already your defense is down, okay? So HIV, again, transmission, sexual intercourse or bodily fluids, but there is also transmission from mother to child, okay? And that is why during our antenatal visits for our pregnant mothers, it's usually one of the tests that we usually do so that we have a plan on how to deliver so for the safety of the baby, okay? Yeah, so we also have viral hepatitis. So we've all heard of hepatitis. Basically, it's the infection of the liver, okay? So it's caused by hepatitis A all the way to E. So there's hepatitis A, B, C, D, and E, which are usually transmitted in different ways, okay? So these ones cause disease in the liver. So let me talk briefly about Ebola virus. We've all heard of Ebola, okay? Who knows what is happening with in terms of Ebola? Anyone with an idea? So there's a current outbreak that is going on in the DRC, okay? And it's Ebola virus. It's a very dangerous disease, okay? So we usually say its case fatality or what deaths leading to Ebola virus is around 50%, okay? So you can imagine an illness where if 10 people get an infection, 5 people will die, okay? So you can see how serious that illness is, eh? The most recent outbreak, as I think as of July, there was a total of around 4,500 cases with around 2,200 deaths. Yeah? So that gives a fatality rate of around 46.8%. Okay? So you can see it's a very serious illness. Yeah? So it belongs to a group of what we call viral hemorrhagic diseases. So basically, what happens is Ebola is usually transmitted through bodily fluids, okay? So either blood, so when you come into contact with blood of an infected person. The other thing is sweat, something like sweat. When you touch contaminated, let's say garments or beddings, okay, which are either soaked with urine, be it vomitus. So that's how you get the infection, okay? So, and it's a very serious infection because even the healthcare workers are at a very big risk, okay? So things like needle injuries when you are taking samples for the infected patients puts you at a very high risk of getting the infection. So usually Ebola, usually the host, usually for viruses we have host. A host is an animal which usually acts as a reservoir. It holds that virus. The virus does not cause disease in that animal, but the virus stays in that animal until they are able to transmit it to humans. And that is how Ebola came about. There's usually not a clear way of how we got to get Ebola, but it is usually thought that there are people who either eat bushmeat, the monkeys, the chimpanzees. So the chimpanzees usually act as the reservoir. They carry this virus, but it's not causing disease in them. And then when now we have those poachers or people who go hunting outside there, they come into contact with the blood of these primates, and that is how we get Ebola. So Ebola, it usually has what you call an incubation period, is the time that it takes for the virus to multiply in your body before it causes the symptoms, usually between 2 and 21 days from exposure. That is 3 weeks. And what happens is that, so once the virus is in you, so it causes what we call flu-like symptoms, yeah? So you will have a headache, you will have muscle pain. You know that description you give when you come to see us, unatuambia unasikia kama iko malaria hivi. Sindio? So that is what it usually starts as. And you see, that is very risky because it can be, if you don't have a high index of suspicion, you can miss it because it will present with a headache, some fever, some joint pains, okay? A very non-specific illness. Actually, the bleeding, which everyone usually fears, usually occurs later in the disease, okay? And it's not for all, it's not in all cases, actually, okay? And that is why the screening, especially in our borders, it's important to screen everyone, okay? So what happens is that now once you have Ebola, so if a person next to you, either they touch you, okay, or anything contaminated by your fluids, that's how they get Ebola. So in terms of treatment, there's no specific treatment for this virus. So what we usually do is what we call supportive treatment. So we usually just hydrate you because of the fevers. So most of the time you are most likely going to get dehydrated. If there's bleeding, so there's blood loss, so we need to replenish that. So it's just supportive treatment. If there's a fever, you give medication for fever, okay? Fluids and of course early supportive treatment, okay? So there's a vaccine being developed, but as I said, it's very it's very hard to consistently use these vaccines because they keep on, the viruses usually keep on changing, as we said, okay? Like now the one that caused the current outbreak is not what was there previously, okay? Like I think we also had an outbreak in Uganda, I think last year, and the viruses, the subtype that caused that is different from now what is causing the infection in DRC. So there's a vaccine, I think WHO has developed 2 vaccines for I think 2 of the subtypes, okay, which have been shown to cause recurrent infections. So the other one is there's Mpox. How many have heard about monkeypox? Okay, monkeypox. So there was an outbreak recently in our country. So there's a virus called an mpox virus, okay? And it's usually transmitted almost in the same way like Ebola. So it's skin to skin when you come into contact with the fluids, body fluids, or contaminated objects or items, yeah? So it also causes a very non-specific symptoms, the headache, the fever, the generalized body malaise, okay? But it also causes a rash. That is why it's called monkeypox, okay? So you'll have very big pimples that sometimes will form some fluid inside there and some pus-like fluid. And that is the outstanding thing about it, yeah? So treatment is also supportive. So what you'll notice with most viruses, yes, we have antiviral medications, but most of them are usually not used for all the viruses. So you'll find that most viral infections we usually do supportive management. So like when you come to hospital and you have a flu, we will not be in a rush to give you antibiotics, okay? So what we are going to do is just manage your symptoms. So if you have a headache, if you have a fever, so we give you the medication to prevent that. The body has a way of eliminating the viruses on its own. The other thing is that most of us have been immunized. Viruses actually were one of the biggest threats to humanity. Okay, there are viruses which have killed over 300 million people. Okay, in the world. There's you can go and look it up. There's something called the Spanish flu. Okay, smallpox. They have been responsible for the death of millions of people. Okay, but the good thing is that now we have, for those viruses, we have vaccines. Okay, so it's very important to make sure that our children are getting their vaccinations as according to our schedule. Okay, so take home message: how do we prevent viruses or viral infections? So transmission of viruses will depend on the system that they affect, okay? So we've said for respiratory viruses, most of the time it's you inhale the viruses, okay? Someone with a flu, they will come, cough, and they will leave that viral virus in the air. So when you inhale, that's how you get the infection. So that is why we were being told to wear our masks. You remember during coronavirus, how many got arrested because of not wearing their masks? Yeah. So it was a public health. It was a public health concern. Yeah. So wear your mask, but most importantly is hand washing. So we've said hand washing for at least 20 seconds. Okay, that's the proper time. Sio ile yetu ya kuguza maji 5 seconds and you're done. So 20 seconds with soap and water, running water. Okay, so for 20 seconds. So it usually inactivates the covering ama nguo ya the virus. Okay, the other thing is washing our food, our fruits before ingesting or before eating, and the last one is we've said vaccination. Okay, so for the girls, we've said for the girls between 9 to 14 years, they can get the HPV vaccine for free. Okay, in any government facility. And even at AR, we have the vaccines, okay? It's good to vaccinate them because it prevents them from getting the infection. I think it's a very broad topic, so let me just keep it simple. I think I'll stop there. In case of any questions, you can ask. Yes? ASOT. Oh. So ASOT is a test, it's called an anti-streptolysin O test, okay? So that one is in relation to bacteria, okay? It's not related to viruses. So there's one of the most common causes of what we call respiratory tract infection is a bacteria called streptococcus. So that is what we test when we do the ASOT test, okay? And why is this important? It's because in the long run also, that bacteria produces some proteins that are usually, they resemble your joints and even some tissue in your heart. So there's a disease called rheumatic heart disease. How many have heard about rheumatic heart disease? So it's the most common cause of heart disease or heart failure in children, okay? If we see a teenager who is or a person 14, 15 years, and they are coming in with symptoms of heart failure, it's almost certain that we'll have to check for that ASOT, okay? Because most of the time, so what happens is that these proteins resemble proteins in your body. So your body attacks itself, thinking that it's a bacteria, okay? So they will present with symptoms of arthritis, they have joint pains, okay? They have what we call valve disease of the heart, okay? So it's usually, so when we test for ASOT and find that it's positive, so we'll proceed to do what is called an echocardiogram for the heart. If there's no involvement of the heart, then we are going to give you what we call monthly injections, yeah? Just to prevent and to prevent the progress of this issue to what we call heart disease, okay? So you will hear some children getting monthly injections, yeah, of penicillin due to a positive ASOT test. So that is the reason. Another question? But you can use for everyone to hear.
Thank you. Mine is about the HPV virus. I have questions in regards to the infection. I would wish to know if there are areas in our bodies that the virus can manifest other than the cervical area. Also, you told us that the virus is sexually transmitted. I've had cases or telltales that if my mom died out of cervical cancer, there are chances that I can also be having the same infection in life. Or is it hereditary, or it's purely transmitted sexually? Another one, we can vaccinate our girls aged 9 to 14. If I test negative when I go for a pap smear test, am I eligible for a vaccine as an adult who is sexually active? Or it's purely for children or young girls? Thank you.
Thank you. Because of time, I think, Doc, you will respond to that powerful question. Then we should end it from there, please.
So for HPV, the other areas that it usually causes symptoms is usually in the skin, okay? So it causes what we call warts, okay? You've seen someone with growths on their skin, which can occur anywhere. Okay, so it can be genital, it can be on the skin, anywhere. So actually, that's the most common. That is where it usually causes disease, mostly on the skin, or what we call warts. So the other issue of whether it's hereditary, no, cervical cancer is not does not have a genetic or hereditary transmission. Okay, so for any cancer to develop, there are many factors that come into play. Okay, but for cervical cancer specifically, genetics is usually not one of them. Okay, so where we have seen a lot of risk is usually in breast cancer. So breast cancer is where if there's a relative who has had breast cancer, so there's a gene that is usually responsible for causing breast cancer, of course with other factors coming into play. So for cervical cancer, no. Okay. So the last question about getting the vaccine. And actually even the boys are getting the vaccine. It's not only girls, okay? Because as we said, it's a sexually transmitted illness. So the boys are the carriers, okay? They're the ones who transmit to the ladies. So if we are talking about vaccination, it's for both boys and girls, okay? But now, because the girls are the ones who are at higher risk of getting the cervical cancer, but the boys also, HPV usually is associated with penile cancer. It also causes cancer, all right? So it's important to vaccinate both boys and girls. So for about the age, so we are saying 9 to 14 years, okay? But even below 40 years, if you go to hospital and we do what we call a HPV DNA test. If it's negative, in consultation with your doctor, we can give you the vaccine, okay? And actually, we even offer catch-up up to ladies who are around 25 years there, okay? If they did not get it when they are 9 to 14, up to 25 years, they come to hospital. We usually do the HPV DNA, actually not the pap smear. So we usually check for the DNA itself. So if it's not there, we give you the vaccine, okay? Yeah. Thank you very much, and thank you for inviting me.
Thank you. What do you say to Daktari? Asante. We want to break to our classes for the visitors, for those who are not there yesterday. Above 20 years in marriage, your class is that far corner. So above 20 years in marriage, mungekuwa mmeanza kutembea the other side. 0 to 9, somewhere here, because there are no chairs there, so you can be here. And then 11 to 19, hapo nyuma. Sasa si tufanye hivyo. Unless there's someone who's not getting Swahili, let's move to our various classes. We have 1 hour. We meet 17:00 hours. Singles matters. And singles, both gender, singles, that's okay. So tumeelewana, matters. So I'm not seeing people weighing, and the youths and the children avoid running. So teachers, please help us. For those who are going home, let them go. For those who want to join, so that we avoid them running up and down. Thank you.